Hello and welcome everyone to our presentation over positive childhood experiences. I just want to mention a few housekeeping items with you all before we get started. Please note that this is a recorded presentation and not a live event. Also, at the time of this recording, we are not wearing masks due to being in private rooms. We will share our contact information later on in this presentation for those of you that would like more information or have questions. It is a pleasure to have you join us today. My name is Ashley Jackson, and I am a program coordinator for the Build a Bridge program on the ACEs team here at the Center for Children's Health led by Cook Children's.
As Ashley said, welcome everyone to our presentation. My name is Frances Wampler, and I'm also a program coordinator here at the Center for Children's Health led by Cook Children's, and I am the coordinator for our ACEs task force here on the ACEs team. We are excited to talk to you all today about positive childhood experiences. And if this is your first exposure to positive childhood experiences or even adverse childhood experiences, we encourage you to check out our other recording, ACEs 101, that is also on our website. As this is a little bit of a part two, we will do a little bit of a recap from ACEs 101. But if you want some more detailed information about ACEs, you might want to check that out first.
So during this presentation, we will define adverse childhood experiences and positive childhood experiences and explain what those are, help you understand the long-term impacts of ACEs on children and their caregivers, also consider some strategies to prevent the impact of ACEs, and finally demonstrate ways that providers can promote PCEs. Frances will now define for us some key terms.
Thanks, Ashley, for getting us started. I wanted to first start by reviewing some of the things that we discussed during the ACEs 101 training that feel relevant for our discussion today. We're going to talk about ACEs, or adverse childhood experiences, what they consist of, as well as PCEs, or positive childhood experiences, and how they are beneficial. Let's first start by defining a few key terms to get a better understanding of the impact of ACEs. So there at the top of the screen, you see a little brain that says trauma. And trauma is an experience of serious adversity or terror, something that is emotional or psychological that brings about that response to something. An example of that might be experiencing being attacked by a dog or being bitten by a dog when you were younger, or living through a hurricane or a tornado, some natural disaster. All of those things could be considered trauma. The second term there at the bottom left of your screen is toxic stress. And the CDC says that toxic stress happens when the brain endures repeated stress or danger. It releases the sense or fight or flight hormones like cortisol. Children growing up with toxic stress may have difficulty forming healthy relationships and stable relationships with their peers. They may also have unstable work histories as adults and struggle with finances, their job, and even depression throughout their life. These effects can be passed down to their own children later. So we're going to talk a lot about that two-generational approach, how the things that we went through as children with our parents have affected us, and how the things that we go through with our children will later affect our children once they're older. And on the bottom right, you'll see in pink, social determinants of health. And these are the conditions in which people are born, grow, live, work, and age. Differences in these conditions lead to health inequities or the unfair and unavoidable differences in health status seen within and between social groups or even neighborhoods. Some examples of social determinants of health is living in a violent or unsafe neighborhood, lacking access to health insurance, not having a stable medical home or following up with routine medical checkups, having poorly funded schools in your area, as well as diminished social capital. So not having connections with people of institutional power like educational administrators or community leaders, as well as policymakers. Also poverty, living in a food desert, or lacking that transitional neighborhood or kind of that community village, that network of support. and also frequently moving. These can all be considered social determinants of health. So we'll be sure to come back to that a little bit later. All right, let's move to defining adverse childhood experiences. Adverse childhood experiences, or ACEs, as you'll hear us talk about throughout the training, are traumatic events that can potentially occur in childhood, so ages 0 to 17, such as abuse, neglect, and household dysfunction. Some examples of ACEs are experiencing violence, such as abuse. This could include physical, emotional, or sexual abuse, as well as neglect. Or growing up in a household where your caregivers experience substance use problems, untreated mental health problems, instability due to parental separation or household members being in jail or prison, having a family member attempt or die by suicide, as well as witnessing violence in the home and in our communities. Like we've said, ACEs can disrupt a child's sense of safety, stability, and bonding and create those toxic levels of stress that can limit healthy brain development. We talked about toxic stress earlier, and we're going to continue to talk about how toxic stress and ACEs impact children and their development. This can also result in short-term and long-term effects on health, behaviors, and even life potential. Some chronic health problems that have been related to ACEs are things like mental illness, anxiety, as well as suicide, cancer and diabetes, physical injuries like fractures or traumatic brain injuries, even risky behaviors like substance use or unsafe sex practices, even having negative impacts on education, job opportunities, and earning potential. I'm going to turn it over to Ashley now to talk more about the history of ACEs research.
Thank you, Frances, for that overview of ACEs and helping us to understand those key terms and how they relate to ACEs. The CDC Kaiser Permanente Adverse Childhood Experiences Study, which largely influences this research, is one of the largest investigations of childhood abuse and neglect, household challenges, later life health, and well-being. The original ACEs study was conducted at Kaiser Permanente from 1995 to 1997 and evaluated 10 ACEs, often referred to as the original or classic ACEs, which you can see displayed here in this image. Dr. Vincent J. Folletti, in his pioneering research, examined ACEs and gave us a different lens for looking at the impacts of those experiences and how they affect children. To note, ACEs are incredibly common. It is found that 61% of adults have experienced at least one ACE, and 12.5% of the population have experienced 4 or more ACEs. As Frances explained, adverse childhood experiences are events that happen in your life, while adverse community environments are those environments in which a person is born or grows up in, which compounds and contributes to those adversities experienced by children and families. This infographic shows how those environments in which we live and grow are deeply rooted from one generation to the next. So when families experience historical and systemic racism or living in poverty for generations, the effects of ACEs can add up over time. Adverse community environments, those social determinants of health shown in this image as the roots, are such as poverty, violence, or lack of opportunity, can create those adverse childhood experiences, which is shown there around the tree, such as homelessness, incarceration, and substance abuse. Thus, having connected supports and systems, think of it as a rich soil for families and children to grow up in, can grow supportive adults in healthy households.
Thank you, Ashley, for that illustration about social determinants of health and ACEs. Now we want to put this into a story format to help us illustrate further how ACEs and social determinants of health can potentially impact someone's life. For instance, a child is born to a low-income family who experience certain social determinants of health or social conditions, and they experience poverty for generations, further adding to that generational approach and that historical trauma. The parents may have to work multiple jobs in order to maintain their household. The child is physically and emotionally abused throughout childhood. Due to the abuse, during the time when the majority of the connections in the child's brain are made, the brain stays in this state of hypervigilance, suppressing memory and impulse control, and trapping the child in this constant state of strong emotional reactivity, or again, thinking back to the terms of toxic stress. They're unable to bring themselves back to calm when they are in a heightened state of stress. The child also has an underdeveloped prefrontal cortex. This is the part of the brain that is responsible for that executive functioning and higher level reasoning, like we just talked about, meaning that they're less likely to talk themselves off the ledge when triggered. Due to a lack of family resources, the child does not receive mental health supports and does not learn appropriate coping mechanisms. They later turn to drugs as an adoption of that health risk behavior that we talked about to numb themselves from the response their body is going through to stress. To maintain their addiction, they turn to prostitution as a source of income, leading to sexually transmitted infections and unwanted pregnancies, leading to the continued cycle of ACEs. Now, the things that this mom experiences with their child are also ACEs that the child will have moving forward. And we can see, if we take this 2-generational approach into consideration, how ACEs just continue to impact families as we move into the future. Thinking about this woman's story, are there ways that you heard in which we could have supported her and her family better to help them have a better outcome? Let's take a deeper dive into how we can help prevent ACEs.
Thank you for sharing that example, Frances. Now we're going to play you a short video developed by the Center for Disease Control and Prevention that will talk more about ACEs, as well as give an introduction to the materials that we will discuss and continue to discuss throughout the rest of this presentation.
You might often hear, children are our hope for a better future. What if you heard instead, we're making a better future for all children possible? You will. Across people, relationships, and communities, we're creating a new standard for the next generation. This generation will thrive, free of adversity. And the time for this change is now. For too long, early negative events have impacted the health and well-being of children and the adults they become. These negative events are known as adverse childhood experiences, also known as ACEs. The science of ACEs shows the effects of growing up exposed to violence, abuse, and family mental health conditions or substance use disorders. ACEs can lead to extreme or repetitive stress, known as toxic stress, that can impact a child's developing brain. They can increase risk for teen pregnancy, sexually transmitted infections, substance use, and chronic health problems. They can also increase the risk of high school dropouts and unemployment. The ripple effects can be felt over a lifetime. The good news is, prevention is possible. Relationships and environments that provide positive childhood experiences give every child what they need to stay connected and healthy throughout life. Everyone can help create connection and a sense of belonging by supporting children and families where you live and work. That's where you come in. You can look for ways to help friends, neighbors, and coworkers, and maybe even people you don't know. As a friend or neighbor, you can offer to make a meal for a family in need, or drive a parent or child where they need to go. As a coworker, you can be there to listen to your colleagues, offer support for what they need, and follow up to see how they're doing. Take breaks and have lunch together. Look for signs of depression and encourage your coworkers to seek help. You can make returning to work easy for new parents by helping with their workload, or start a parent support group. As a mentor, you can volunteer to work with young people, sign up to read to or tutor students. Parenting is hard. Support helps parents and children, even in the best of situations. Support community programs that provide safe and healthy conditions for all families. Healthy childhoods, supportive relationships, and resilient communities start now with your help. What will you do? everyone can raise awareness about community solutions that provide safe and healthy conditions for all children and families. Learn more about preventing adverse childhood experiences.
I love that this video shows some simple actions, steps that we can take to support families. So we've talked about the consequences of adverse childhood experiences. And again, the example that Francis provided depicts how those traumatic experiences in childhood can have lasting effects long into adulthood. The image on the right side of your screen is the cover page to a periodical that the CDC has put out. It has some great information about how we can prevent ACEs that you may want to refer to later on following this presentation. An excerpt that I do want to mention from this periodical states that creating and sustaining safe, stable, nurturing relationships and environments for all children and families can prevent ACEs and help all children reach their full health and life potential. The next graphic on your screen shows the potential reduction of negative health outcomes in adulthood by preventing ACEs and what that could look like. The first table in this image shows the potential reduction of health conditions like depressive disorder, chronic obstructive pulmonary disease, asthma, and so on. The table in the orange box below that shows the potential reduction of health risk behaviors for current smoking and heavy drinking. And finally, the third table shows the potential reduction of socioeconomic challenges such as unemployment, less than a high school education, and no health insurance. Now let's move on to talking about some strategies for preventing ACEs.
Thank you, Ashley, for the overview on the CDC's potential reduction of negative health outcomes through ACEs prevention. I love that the video also did a really great job of highlighting ACEs and prevention work, as well as positive childhood experiences. Let's talk about a few strategies and approaches for preventing ACEs. Some things that we can do is promote social norms that protect against violence and adversity. These could be things like public education campaigns and including men as allies in our prevention work. We can also teach skills to help caregivers and youth handle stress, manage emotions, and tackle everyday challenges. Things like safe dating and healthy relationship skills programs, as well as parenting skills and family relationship approaches. We can also intervene early to lessen the immediate and long-term harms of ACEs by promoting protective factors. These are things that can support individuals or populations to lessen the potential risk for harm. Things like family and community support and skills in coping and problem solving, ensuring a strong, healthy start for children and paving the way for them to reach their full life's potential, as well as enhanced primary care that addresses social determinants of health and values equity to ensure that families have access to physical and mental health care, as well as family-centered care, taking into account, again, that two-generational approach and support for the entire family. We can also work at building connections, connecting youth to caring adults and activities. This can help to ground them, improve their engagement in school, and establishes positive networks and experiences for children. Thinking back again to toxic stress, like we talked about in the beginning, these situations can leave our brain in a heightened level of stress. But when people have supportive adults and safe environments, they get the chance to practice how to return back to calm. This builds their capacity for resiliency. Let's shift our focus now from adverse childhood experiences to positive childhood experiences. Christina Bethel of Johns Hopkins University is one of the major researchers on positive childhood experiences, and they define a positive childhood experience as feeling safe in our family to talk about emotions and things that are hard and feeling supported during those hard times. So when you're enduring those toxic levels of stress, do you have someone there to help you buffer those things that you're going through and be there for you during those hard times? The research done by the team at Johns Hopkins has shown that when PCEs are actively promoted during early childhood, adult mental health risks are significantly reduced. I'm going to turn it back over to Ashley to talk more about positive childhood experiences and their benefits.
Thank you, Frances. As Frances mentioned, positive childhood experiences can be defined, again, as feeling safe within our families to talk about emotions and things that are hard, and feeling supported during those hard times. Studies show that positive childhood experiences before the age of 18 are beneficial for children in so many ways. They can counter the effects of ACEs, result in better health outcomes, and also enable resiliency even in the face of adversity, so those hard times, those challenges. As we learned earlier, these relationships are key to creating positive childhood experiences where children can thrive. Preventing ACEs by encouraging positive childhood experiences shows a reduction in cases of depression, heart disease, obesity, and lessens those immediate and long-term harms. Children's relationships affect the way they see the world and provides a foundation for the rest of their life. Positive childhood experiences with family, at school, and in neighborhoods are beneficial for children. So when children have those safe, stable, and nurturing relationships with their caregivers and their basic needs are being met, they're less likely to report mental distress, those things such as stress, depression, and emotional problems. When actively engaged at school, maybe among their peers and also with their teachers, children show positive mental health outcomes and protection against adversities. And lastly, PCEs in neighborhoods are associated with reduced family ACEs, lowering of parenting stress, and peer bullying victimization. So these supports enable a child to bounce back after a stressful situation or occurrence in their life because they have had those positive childhood experiences, safe environments in which they live and grow, and supportive adults in their lives. So those things provide those buffers for those children. Now, Frances is going to share with you some examples of PCEs.
Thank you, Ashley. The absence of positive childhood experience and relationships may be more detrimental to lifelong health, so we need to focus on increasing those positive things throughout childhood. Let's talk about some examples of positive childhood experiences that can help children grow into successful adults and can offset the negative effects of adverse childhood experiences. When children have safe, positive experiences with healthcare professionals, and when they feel like they can talk freely with their family about their feelings and feel supported by their families, when children are able to participate in community traditions, and when they have a sense of belonging at school, and when they feel supported by their friends, when they feel safe and protected by adults in their home, as well as having a non-parent adult show an ongoing interest in their life. All of these things continue to help children make those connections, like we saw in the video, and gives them the opportunity to go through these stressful things in life and be able to bounce back from that. We can create positive childhood experiences by doing several things with each other and in our communities. We can promote positive parenting practices. We can help children have a healthy start by encouraging families to find a medical home and maintain those well child appointments. It can be really nerve-wracking to not know where to go when your child is sick or not having a stable relationship with a healthcare provider. Modeling those healthy relationship skills for parents, encouraging participation in those local activities, sports, and clubs, helping families get engaged in the community and build their own support networks. And again, identifying those social supports and community resources. I'm going to turn it over to Ashley to give us an example of something that you all could do to help encourage positive childhood experiences with the children in your work.
Thank you. Let's now talk about some implementation strategies. For those of you that may provide childcare services, you can set aside time for special play time with the children that you care for on a day-to-day basis. Play is a child's language, and it's crucial to a child's development. It teaches a child lessons and helps prepare them for many future adult roles. Items that you can use to facilitate special playtime include things like blocks and coloring books, which can help teach physical dexterity, so children are able to use their fingers and hands to perform a task. Also, play with figurines or toys helps them to understand the world around them, their relationships, and also enables them to recreate experiences and expand their imaginations. Play also offers the opportunity for children to identify different skill sets that they may have, talents or abilities, and provides an opportunity to release stress and opportunities for more joy in their lives. Some tips that you can use during special playtime is to spend about 5 to 10 minutes playing with a child each day. Be consistent with this time and try to make playtime happen about the same time each day. Also, allow the child to take the lead in making some decisions during playtime. This helps to build their confidence and their independence. Be enthusiastic when you're having playtime and praise those good behaviors. This communicates that you're interested in what they're doing and also promotes that positive reinforcement, so they'll continue those good behaviors. Frances is going to share with us another example that you can use with the children in your life.
All right. Knowing that not everyone is in a childcare setting, we wanted to also highlight some other activities. Teachers and educators or others that work with families and caregivers with children can do activities for self-care. This could be things like journaling or drawing, encouraging physical activity like jumping jacks or going for a walk, even modeling things like meditation and positive self-talk. These are things that you could do together to help encourage those different types of self-care. The benefits of self-care can be promoting those caring and supportive relationships and social-emotional skills that underline positive development for children, and helps encourage skills like empathy, self-regulation, and self-efficacy. I know that so many of our youth are struggling with mental health, and so these are things that we can all do to kind of help them with those different things and help enable resiliency.
So what can we do to make a difference? So with those families and caregivers that you interact with, you can encourage them to establish routines. This helps to create structure so their child knows what to expect at home. Also encourage them to set aside some time each day, as we talked about special playtime, to talk and play with their child. It allows them to connect one-on-one with their child. Also encourage parents and caregivers to stay connected to their child's providers and educational team. Those strong partnerships with these providers is essential to their child's well-being. And we can also encourage parents and caregivers to participate in local activities to stay connected to their local communities. Another way that we can support families is by encouraging development of nurturing and supportive relationships, as this is also important for a child's development. Also just by being a listening ear and offering support and encouragement to those families that we interact with. And also supporting or promoting social norms that discourage violence and protect children from harm, such as positive parenting practices. So this is an overview, and we have provided you an overview of positive childhood experiences and some strategies that we welcome you to utilize in your daily work with children and families. Now, Frances will wrap up our presentation with a few closing items.
All right. Your feedback matters to us, and we definitely want to give everyone the opportunity to complete the survey and provide feedback to us on how we can continue to make improvements as we continue to share education and material with the community. If you have your smartphone handy, you can scan the QR code here that will take you to a virtual survey that should take you 2 to 3 minutes to complete. As we have discussed today, childhood experiences, good and bad, shape our health, well-being, and livelihoods over a lifetime. We hope that this overview helps you find ways to encourage positive childhood experiences for the families around you and support building resilient communities. If you have any comments or questions, please feel free to reach out to us at our email address listed on this slide or you can also visit our website for more information on ACEs or our other community outreach programs. We appreciate you spending your day with us, and we look forward to having you on another training with us. Thank you.